So welcome to the webinar Trio Scanners Resolving Common Complications for Effective Digital Impressions. It is being presented by our iOS team and a guest star from 3Shape Trios. And with that, it is now my pleasure to turn the reins over to Kelly Bevington, RDA, EFDA. She is our Director of Intraoral Technology. Take it away, Kelly.
Thanks so much, Jessica. And thank you for being here this evening. We really look forward to being able to provide this type of an educational session to you. And we don't do panelist presentations that often, so it's a nice way for all of us to share our experiences and like helpful hints and tips. So I manage the training team. As Jessica said, I'm an RDA EFTA by original training, and I've been with the lab almost 30 years now. We also have Brenda Kirkin. Brenda is a CDA RDA. She comes to us from the private practice as well as the land of academia, where she was on faculty at University of Detroit Mercy. And then we have Brittany Carey, who's a registered dental hygienist. And Brittany comes to us from private practice as well as years of experience working in the DSO world. So we've got a nice mix of our training team. And I would also like to introduce Christy Boda. Christy comes to us from 3Shape. So our vendor, manufacturer, partner that we rely heavily on, right, to support you with the best resources and support that we can. So we're going to talk about common complications. We encourage questions. I do want to make sure that I say thank you and really honor those registrants that took the time to provide us questions to address in this evening's program. If it's not for your participation, it would make our content rather light, right? So our learning objectives for this evening, we're going to successfully determine a scanning strategy, understand and navigate the limitations of various intraoral software, and improve case predictability and efficiency. This is us. This is our training team. Feel free to take a screenshot of anything that you may want to. So this is, our contact information in the event you need some assistance. And this is also included in your handouts for this evening also. And this is Christy. Christy is a senior manager of customer experience at 3Shape. But Christy, if you would take a moment and just tell us a little bit about how you best support the customers.
Hello, everyone. My name is Christy Bota. I'm a senior manager, as Kelly just stated, with 3Shape. My team is involved in the customer experience. Our responsibility is that everything post-sale in North America funnels through the customer experience team and the academy team. And my job is to kind of manage both of those teams and facilitate training and clinical support as far as the onboarding journey, and then everything post-sales, post-training, up to your time using the scanner and the software. So it's just ensuring a good customer experience and being that liaison between our clinical team and our hardware support team in Columbia.
That's terrific. Thank you so much. Think of us as a resource. So we frequently do podcasts and articles. We have different scanning documents that the one to the far left will be included in your handouts as well tonight. And although we're talking about 3Shape Trios as a product line, I won't say most of our experience, but we are going to focus a little bit perhaps more on Trios 5 than 3 and 4 based off of the inquiries that we received during registration. So I find this slide to be very helpful. Again, if you would like to take a screenshot of this, it just gives you some really nice ways to get hold of or learn more about 3Shape, from their website to their support number. We're going to address some different items. Brenda will live as far as the settings and guidance hints. How do you know what subscriptions you already have on your scanner, or how could you obtain additional ones, as well as their Learning Academy. So in reviewing some of the questions that we received from you all as registrants, I'm going to move my box here a little bit. Here's a question that came up. Can you change the focal size or increase the mesh density more than Trios already does to give even a higher resolution? Oh, pardon me. There we go. So the short answer in my experience is no. There is a zoom feature that we can certainly use, but it doesn't really increase the resolution itself. Brittany, Brenda, Christy, would you care to chime in on that one?
I'd be more than happy to do that.
Great.
Well, you're not able to change the focal depth on the Trios. You can utilize the zoom tool to that functions to concentrate on areas that may be a little bit more challenging to acquire data, if that makes sense.
Yeah, absolutely.
Yes, that's correct. It helps to localize on the specific areas of importance, and allows you to, like Brittany just said, increase the data and just focus in on that specific area.
So we actually I'm going to address this now because I see that it sort of ties in. We had a question come in, or a statement, that they were unable to scan the intaglio surface of a full denture in the anterior area because the area was too deep and the scanner head couldn't get close enough to pick up what could have been done in this scenario. Now, personally, I have used the zoom feature for that type of scenario with success. Would you agree that that's an alternative to use Zoom? Or would there be a different recommendation?
I agree that using Zoom would be appropriate there. Is that I'm sorry, Kelly, were you asking whether Brittany or I for that answer?
Either.
Okay. Yes, I think Zoom would be appropriate. I've even seen clinics turn into a more of a monochromatic color, that way you are able to kind of see more of the anatomy in detail without the color being as dynamic. So you can turn the color off, and then you can also use the zoom feature there.
Perfect. So what's next? Capturing edentulous ridges or impartially edentulous or fully edentulous patients. We were chatting a little bit about this earlier. Brenda, would you like to share your input there?
What you would like to do is, if they're missing their back molars, you want to at first start on the teeth and then go. And then when you get to the edentulous areas, more on the lingual, like a 45-degree angle, but you're going to want it nice and retracted.
Super. Anything else?
And just
anyone else?
It's better if you have in those really difficult areas to do four-handed dentistry, so you have somebody that is able to really retract the tongue, especially if those edentulous ridges are on the lower, like those little knife edge ridges.
Mm-hmm.
Yeah.
Yeah, good retraction, good moisture control, good stability. Also, because of the light that the Trios has, you can also turn off the overhead light to reduce any reflection in the scan. So with all of these tips and tricks,
loops, if the doc is wearing loops with lights, yeah.
Yes.
Absolutely.
Yeah, so all of those things. I've even seen doctors use markers to grab the tissue, to kind of have a spot, an identifier to grab the tissue, to continue on scanning on the scan path. Because those tissues with those edentulous spaces, sometimes it may be difficult for the scanner to pick up those areas. So just good tissue retraction, moisture control, reduce the lights, whether it's through loops or overhead, and maybe adding some markers on the gingival tissue so that the scanner can grab the scan and continue on the scan path.
So I've had great success, and I think this is what you're referring to, but just for validation as a marker, I use Dr. Thompson sticks.
Yes, exactly.
And create like a little X or a little
Yes, or a
line.
little dot there. Yes, exactly.
And it's more for me, right? It's for my eyes to follow the path. And I've found that to be quite successful, and it's inexpensive. Most practices already have that type of item as well. So let's roll into the next, which is sort of goes hand in hand, right? Is managing that patient with excessive saliva, a sensitive gag reflex, maybe a super large tongue, tight lip. Brittany, I think you already said it for the one above, right? You want to do a repeat?
Sure. Well, of course, like Brenda said, if you're able to do four-handed dentistry to make it a little bit easier on everyone, all for it. Of course, too, if you can kind of distract the patient by maybe allowing the patient to look at the screen while you're scanning to kind of divert their attention away from the need to gag, perhaps.
Brenda, anything from you?
Yeah, so with patients that have excessive saliva, what I like to do is, of course, make sure that they swallow and everything, but I will put a saliva ejector in on one side, have them tilt their head so everything pulls that way, and then scan half of it, and then put it on the other side, scan half of it after I dry. Gag reflex too is if you have them watch, distract them. Large tongue, four-handed dentistry. Sometimes you have to call that other person in to help.
Yeah, for sure. So for saliva, I really like to put dry angles, like neo-dry angles on the inside of the cheeks against the parotid glands. I find that when we're retracting the cheek, for some patients, not all, that it milks that gland, and all of a sudden you end up with a puddle on the mandibular arch, and it's more difficult to manage. Gag reflexes, or anybody that's a little nervous about things. I had a dentist years ago say about distracting, right? And ask them to maybe cross their feet, try to wiggle their toes, anything that gives you just that 10 seconds to capture the most distal area, posterior area that you're trying to acquire data. And then that tight lower lip, that can really be a challenge. The person's like really tensed up. And I will use, the finger from the opposite hand to help retract, or the wand itself to help retract. But we're all right. Like there's nothing like four-handed dentistry in a pinch with some of those types of patients, those more challenging patients.
And it's even in the past, and before 3Shape, I worked in oral surgery, and we would have patients that would gag, and we would place a little bit of salt on the tip of the just as a distraction as well to prevent the gag reflex.
Yeah, very good. I forgot about salt. Yeah. Bite registration. So the comment was made, sometimes the arches come together quickly and sometimes they don't. And Brenda's going to show us an example of how to manually set the bite for when they don't come together quickly. But I know for myself, really instructing the user to make certain that they are capturing a good, 4 millimeters of gingival tissue above or below the CEJ, I think is really critical. So that those markers are there and available for the software to merge the mandibular and maxillary scans together. But let's go around the horn here and find out what other tips or tricks you may all have experienced.
Well, I'll add on to that. Of course, you want to make sure that you're at least capturing 4 teeth in the scan for the bite registration, if not more. And of course, if you have an edentulous area, I wouldn't bother trying to scan the bite in that area if possible. I would focus more where there's teeth making contact.
I'll pipe in.
Yeah.
I also experience a lot of time leaving the scanner in position and turning it off and turning it back on. A lot of times would allow the bites to connect. Definitely, as stated, that the posterior area, just kind of move where you can grab the teeth if they're edentulous in the posterior area. But if you can move to at least where we have teeth occluding, then you can definitely grab that bite.
And I don't think we've mentioned, but I'm very much a proponent of sitting the patient upright when I take their bite registration. I think it's a bit of a disservice for us to expect a patient who's been upside down on their head for a half an hour to close normally when we ask them to close normally. And most importantly, that we really we are able to recognize what their normal bite is, right? That we paid attention to what that was before they were anesthetized and perhaps crown preps had been done for the last 30 minutes or so. I also have a response from one of the attendees when it for the question just prior about the patient with the excess of saliva and gag reflex, to tell them you're going to take out the alginate and take an analog impression. I thought that was great. So let's see, best settings to allow for scanning of edentulous areas. One of the things I really like about the 3Shapes Trio scanner is it gives you options, right? So many systems out there don't provide you options for scanning the edentulous patient. So there is a setting to scan a denture. There is a setting to scan an impression, and then there is a setting to scan the fully edentulous patient. And Brenda will be able to show you what those particular icons look like during the live scan portion as well. They have difficulty when a prep is subgingival to make sure that it is fully captured in the scan. Now I know we all have some opinions about that. Brenda, I'm going to let you start with that one.
Okay. Best have difficulty when a prep is subgingival. So you have to make sure you have, if it's too deep, there are times that the scanner can't reach that, right? But the best thing to do is make sure you have nice retraction. And if it's nice and retracted subgingivally, a lot of times you can scan it. You can utilize the zoom tool that I'll be showing you a little bit later that will make it easier for you to see that you're capturing the correct area. And make sure everything's nice and dry.
Yeah, I know we're all proponents of double cord techniques and leaving that first cord in the sulcus during the scanning process, as long as it's below the finish line, of course. So that can certainly be of assistance when scanning something that is a little bit subg. Okay, second page of questions.
All right, some additional trios questions and scenarios that we experience out in the field. How do I keep crown margins dry while scanning? Brenda, did you want to kind of go hand in hand with the last question?
Right.
If you want to dive into our gold standard.
Right. I like to use dry angles. I like to make sure I do a double cord. First cord meets perfectly. I usually do a 00 and a 0 or a 1, depending what you need. And then before pulling the retraction cord, I put a little bit of like a drop of water on it and pull the cord very lightly and slowly so it doesn't rip off. And then I usually like to use a micro brush to dry it to make sure everything is nice and clean. And then I usually use 2 fingers to retract it. I like to do my crown prep and then the tooth behind and the tooth forward and then continue. That way, if you do get hemostasis starting, then you're past that point.
Good call. How do I rescan a missed crown margin? Can I simply rescan the missed section without rescanning the entire prep? Kelly, you want to touch on that one?
Yeah, so there is something called a lock tool and a trim tools, which would enable you to lock and save the good data, and trim away the data that needs improvement, make your correction, and then rescan that. And you can also rescan that in Zoom too. And Brenda's going to actually do a demonstration of that scenario. I think that's a big one. That's a wonderful feature that Trios has that people don't take full advantage of.
I agree.
Absolutely.
Agree.
Can you remotely access my scanner for scanning assistance? Brenda, can we?
Yes, you can. And I'll show you that when I demo.
Of course, we'd love to be there chairside live with you. But in the events we can't, we are more than happy to assist and provide support remotely as well.
Right.
Yeah, as a matter of fact, if there's a special case coming up that you're a little concerned about, you need a little extra confidence with, maybe it's the first time you've scanned an implant case or first time you're scanning a fully edentulous patient, we can pre-schedule time that we can then remotely access into your scanner and sort of be there with you over the shoulder, or immediately assess a scan afterwards. I've had people FaceTime me or send a little video
Right.
after hours. How does this look? And so know that we're here to support you. Know that we're here to support you. And we're typically in dental operatories every day, or at least a few times a week. So the more advance notice we have, the better. But that's something we really get excited about, helping you like on the fly.
Mm-hmm. Absolutely. Who wants to touch on color calibration?
I will, because I made the error once, and that my system wouldn't calibrate, and I was getting really, really frustrated, and ended up calling 3Shape support. And here it had expired. There is an expiry date on those color calibration tools for 3 and 4, and I was not. I mean, I was educated on it, but I wasn't like fully aware of it. So I got caught up in the frustration. So if you have a color calibration tool, just make sure that you understand what the expiry date is. Delegate it to one of your auxiliaries to make certain that these things are reordered and replaced ahead of time, not when it fails on you
After the
on
fact.
site. Yeah.
Right. And we actually did get a question in the chat. Is color calibration necessary?
It depends if you want to use it to take a shade, right? And if you want to take some images of teeth and ask the laboratory to match up some of those shades. That's my opinion.
Yeah, it's necessary if you would like to get an accurate shade. But if you're not scanning in that area, if you don't require a shape measurement for that particular tooth or that area of the mouth, then it wouldn't be necessary.
Oh, we did get another question.
Yeah.
Do we need to color calibrate 3Shape 5? I'll take that one. No, you don't. One of my favorite things about the Trios 5 is it doesn't require calibration. Pretty neat.
Yeah, absolutely. We actually have another question that came in. They lost the meeting for a moment and popped back on, but their question was the bite question. Why sometimes it merges together right away, and other times it doesn't. So typically it's data that you acquired on the maxillary and mandibular scans before you ever tried to scan the bite. So you want to make sure that you've got a good 4 millimeters of gingival tissue above the CEJ or below the CEJ as points of reference for the software to merge the maxillary and mandibular scans together. You also want to make sure that the patient is still, right? If they move in the middle of the bite acquisition, that can cause the registration not to come together quickly. And you need to scan enough teeth, right? It's not just up, down, and you're out. You need to get, 4 teeth in place. You don't have to go the whole way back to the most posterior tooth. However, if you have a partially edentulous area, I would not start there. I would start like where the teeth interdigitate, somewhere where teeth are in occlusion, and then move forward with that. I hope that was helpful.
And the only other thing I would add to that, that we didn't add to earlier, was make sure that the patient is closing, that they're not shifting their jaw, excuse me, while you're scanning. They're not slightly opening while you're scanning. It's just like an X-ray. If that happens, it's kind of one of those delete and redo.
Yeah, agreed.
And to kind of go, well, we did have another question. Do you always have to send 2 bite scans? If you do a full mouth scan, you need to do 2 bite scans, 1 on each side. And Brenda will show, we'll do a demonstration of that as well. Because on the Trios, you do have to make sure that you are on the correct bite. You're scanning the correct side under the, you'll see.
Yeah.
Finally, really quick, why would we select the adjust for contacts tool? Christy, did you want to touch on that?
Unmute myself. Absolutely. When we're looking at the adjust for contacts tool, we sometimes may select for it to be open, and that just is for the variations of if someone is clenching or has a deep bite. But if we want to turn it off, it just allows for the true bite of the patient. So like if you have crowns, bridge work that you're commonly doing, then you may opt to select to have it off. By default, it will be off, and you can select to have it on, but you do have that option depending on what type of bite the patient may have.
Terrific. Thank you. I want to be respectful of the time we have allocated for Brenda to do the live demo. We've got additional information here, but it's what makes a great digital impression. We've reviewed about isolation. This is part of your handout, so I'm not going to spend a lot of time on this. Just an example of color versus monochrome. And if you're a user and not using monochrome, I would encourage you to do so. This is a really nice example of a little tissue tag that maybe it doesn't look like that big of a deal in color, but boy, when you shift it to monochrome, you can really see it and would want to correct that. And just a couple things about implants. I wouldn't be doing my job as a representative of the lab if I didn't mention the fact that a few things that we always need to know when it comes to an implant case. And that's the manufacturer, the scan body type, the platform, what type of a custom abutment you want, and what type of a crown you want. Do you want it screw retained or cement retained? And so important to us and to you and to your patient to take a radiograph of the scan body in place to verify that it is fully seated. I'm always so disappointed when we'll reach out to a doctor to see if they have a radiograph because it just doesn't look right to us. And I'm saddened that people are not taking that verification x-ray. So super important. And this is an example of same case, right? But one, the scan body was accurately placed and confirmed seated, and the other was not. In case you don't know what scan buddies are, reach out to us. Reference dentures, copy dentures, immediate, reach out to us. This is Brenda's little tip and trick of putting some flowable on that shiny palette to help acquire the data where sometimes it's really difficult to acquire that. And the live demonstration. So this is what Brenda's going to be reviewing. It's some of the setting information, guidance tips, how to group labs. Really love that one. And the like, right? So I don't want to take up more of that time. And I'm going to stop my share here. So this is us. This is how to reach us. I'll share that again here at the end.
Okay, so the question mark, if you click that, you have remote access, and that will give you a team view. Then there's training, what's new, support. And if you are calling tech support, if you click this letter I, it has your dongle information, everything that you need for them to help you. Letter I is your guidance hints.
And the guidance hints, we highly recommend leaving the guidance hints on. There's turnover in offices, right? New team members come into play, new associates come into play. And it's so easy for them to watch the video or read the instructions. And as soon as you start to scan, it goes away. So there's no value in our opinion, in removing it or ask not to see it ever again.
But for going to add a case here for the denture. So right here is where, if you have multiple doctors in an office, or if you have an aesthetic lab or lab that you just want for your removables, you can group them together. So right here, this is going to be Dr. Jones's favorite labs. So then you'll see down here where it says Dr. Jones. So those are his two favorite labs. And then we're going to go out. Our new case. I'm just going to. His favorite lab is the iOS training team. And here's your guidance hint. So if somebody has accidentally checked it, you can just uncheck it. Once you get better, you can just exit out of it. And we are going to do removable full denture. And we're going to do a printed one. You always want to make sure you have your delivery date set. And then we're going to go to next. And we're going to scan the lower first. And once it turns green, then you're usually good to go.
And notice in the center of the screen towards the bottom, there's a white box with a blue scanner inside indicating that the AI is on.
Right. So for the upper, you'll see that the AI is off. So here's the lower, I like to really check it real quick. Okay, it looks great. Now we're going to go to the upper. And then it's going to ask you, how do you wish to scan your upper jaw? If you're doing your intraoral, of course, you'll be intraoral. If you are using a reference denture, you would do impression, or if it is just a physical impression, you can scan that, but we're doing a copy denture. And you can look at the guidance hint to see your ideal scan strategy. For demonstration purposes, I'm gonna go quickly on this.
And while she's doing that, even though she's scanning the correct arches under the correct category,
Yes,
we can still show you where the tool is to swap scans in the event that you accidentally scan the wrong arch under the wrong segment.
Oh, there's your flowable.
there's my flowable. Even though this denture has a lot of landmarks on it, I really didn't need it for this one.
But there was a participant that asked earlier about techniques to allow them to capture the intaglio of a denture, that it was perhaps a little too deep. So it could be some reflection, right, going on, not allowing you to see it. I would probably use the zoom feature first and see how that fared, but a little bit of flowable in that area just to sort of have something three-dimensional for the scanner to pick up might be worth a try as well.
Yeah, because a lot of dentures, the acrylic is really thin and
Yeah.
the light wants to pass through. So a lot of times I'll put a glove underneath it so the reflection doesn't go through too much. And as you see here, there's an opening. So I usually then like to come back in to connect those areas, and I will just rock back and forth to connect those. Sometimes if there is a really deep area, if they have like a knife edge ridge that, or an undercut in their existing denture, we can do the zoom on that. But I'm going to show you here for the tools for the swap scan. If I accidentally did my lower where my upper was, then you could hit swap scans and then it would have done it.
And the playback is located there as well. So anytime you want to take a look at somebody's like scan path strategy, that gives you an option to review how they really scanned as well.
Right. And that's helpful for us as trainers to see if you're having a lot of issues, then we can see if, you know, someone's scanning different, because, and most of the time, if they don't have that guidance hints and they're used to a different scanner from maybe another office that they came from, each scanner has their own scan path strategies. Okay, so that's the zoom tool there. And then I'm going to do the bite.
And while you're doing that, we did get a question in the chat. Why does the scanner scan at different speeds? And that could depend on a couple things. Like Christy had said, you want to make sure that because the scanner itself has its own light source, it really doesn't like any additional light. So if you have your loops on, your overhead light, you want to make sure those are turned off. If the if the mouth isn't dry, if it's wet, the light will reflect off of saliva, off of any other kind of fluid. And of course, if you are not following the proper scan path protocol for what you're scanning for, will also slow down your scanning.
So if it doesn't come together, how you can manually put your bite together, right? So this is kind of lower. You find a reference point, and then you would make a mark on each side.
Easier said than done, for sure.
Yes. We'll see how that.
Especially if you don't have a mouth.
No, that I'm not accepting that. That is clearing that bite. On a denture, that one's wasn't very good, but
That's fine.
so what I would like to do now is go to a scan that I did earlier. Skip that. And
Here's an experienced user stating that they really don't like to ever accept the manual bites. And I don't disagree with that.
And that's the same way. So I will go back and acquire that additional information that I need.
Yeah.
There's different ways that you can protect it from cleanup. One is here. You can, if you click those three dots, you can import scans, export, make a copy, protect from cleanup. But I'm going to open this case up.
And we also saw that tool is located under the toolbar as well, with the playback scan and the swap scan.
Yes. So for trimming your model, because I really went and made sure it was too far, what you can do is trim your model and remove patches. If you did laser, a lot of times it will go to infinity. So make sure if you use a laser that if that line goes through, it's not going to take off any of your other information that you want.
I missed something. A doctor just asked if that tool should always be left on, but I'm not sure what she's referencing.
Is it the protect from cleanup tool, perhaps?
Oh, maybe.
Yes.
So I'm going to go.
Yes.
Yeah. So
No, it doesn't have to always be on. No.
No. You will eventually want to take that off if you're saving it, because it will save it onto the computer instead of going into the cloud. But protecting from cleanup is if you did like a gross prep and the patient's coming back in 6 weeks to have the definitive, like re-prepping the margins, and that way you can, remove that area and scan, or you can scan that whole upper arch again. Or if you're doing multiple, like if you did an implant and then after the implants crowns are cemented, you want to then send that off to have an occlusal guard made.
Good examples.
So here we have a prep, And oh my gosh, the cord right here on the buckle. What am I going to do? Instead, like I have all my margins look beautiful except that area. What I'm going to do now is I'm going to lock the surface and I'm going to do 4 millimeters. I am going to lock the adjacent teeth. It's up here.
So she wants to make sure that she's locking everything that she likes and wants to keep.
And I don't want to put additional data on my contacts because I don't want to open margin on the adjacent teeth. So,
Open interproximal contacts.
right. And now what I'm going to do is along the gingival area that I want to keep, I'm going to lock that all in. And I know my occlusion is, I have enough occlusal reduction. I'm just going to go there. And I like to do this on model form because you can see it better. And
Yeah, better definition.
now I am going to trim that gingival area. And I'm going to zoom for that area. And then I'm going to turn my, so I'm going to take that button out of there. I'm going to come back in. And there you have that area is all completed now.
Perfect.
So it's a really great way to modify a scan that's, 90% perfect. And there's just a small area that you want to modify, correct, and rescan instead of starting from scratch. Really, there's no reason. There's no need
Right.
to start from scratch.
And I know that there are different excitement apps that you may have or you may not have. Like your subscriptions, you go to settings to see what you have. And it's right there. And then you can find out what you have with your trios. Trying to check to see if there were any other.
The only thing I don't know that we mentioned was how to copy a case.
Okay, so
We did.
Did we?
yes,
Mhm.
it's like that 3 dots right here.
Mhm.
And you can make a copy.
Got it. Perfect.
And I'm gonna.
And so as a lab, we will frequently get calls. Hey, I accidentally sent this case to such and such a lab and I was able to call them and tell them not to make it. But now I want to send it to you. How do I get it to you? So they need to copy the case and then send it to us.
Right there.
I think that covered everything on my live scanning list. And I appreciate your patience with some technological difficulties from time to time.
Yes.
Brittany, did you have anything else? Christy, is there anything else that you would like to add?
Ladies, and
Yeah.
thank you,
Thank
Christy,
you.
for joining us. I always love these training sessions. Being behind the scenes and producing, it's always neat to see the connection you make for the practices to the lab to all the way to the patient to make their experience better. Because it's all of our jobs to make sure that the world smiles better if the patient's relaxed and experiencing wonderful experiences in dentistry.
Indeed, indeed.
Right.
Yeah.
That's right.
So
Thank you so much for your time. We really appreciate you choosing to spend your evening with us. Thank you, Brittany, Brenda, Christy.
Thank you.
Really appreciate the support.
Thank you.